outlining 5 key career pathways that will hopefully give you insight into how you can develop within your nursing career. Be the nurse that you want to be and that you know you are capable of becoming. Hello everyone and welcome back to my YouTube channel. My name is Zara and I'm a registered nurse working in the UK. I like to refer to this channel as insight into the wonderful world of nursing, where I make vlogs, student videos and even some teaching based videos as well. In this video we will be exploring different nursing career paths. If you've ever found yourself asking the question, what kind of nurse do I want to be? I'm passionate about nursing, but I don't know what I want to do. Everyone has figured it out. Everyone seems to know what they want to do. Why don't I know what I want to do? Shh, it's okay. If you have clicked on this video, then you are certainly in the right place, because I'm going to be outlining 5 key career pathways that will hopefully give you insight into how you can develop within your nursing career. I will leave timestamps in the description box below so you can chop and change to whatever takes your interest. Credit to the Royal College of Nursing, university links, and some of my colleagues who have also helped in making this video. Let's get started. The great thing about pursuing a nursing clinical role is the range of opportunities that come up. Clinical practice and the hands-on care of nursing is the aspect of nursing that I love. Hands-on care, applying what we learn in university textbooks into a skill that will hopefully benefit a patient, is something that I personally love. Depending on what speciality you are interested in, you will always find some sort of clinical practice within that. You can become a clinical nurse specialist and become an expert in a field that you are passionate about. You can develop into a junior sister or a senior sister. You could become a theatre nurse team lead. Or you can even become an advanced nurse practitioner where you're taking your clinical skills to an advanced level. If you like the sound of a clinical nursing pathway, then here are some suggestions on how you can develop. Speak to your current line manager about opportunities where you can develop your clinical practice. One way that you can achieve this is picking a skill and becoming the designated lead for that skill. For instance, when I worked on the wards, I was interested in pain management. I raised that in my appraisal to my line manager and I was sent on a course to develop that skill. I was then able to use that experience in my job application when I applied as a junior sister in pain specialist services. So if you've got an area of interest, then do try to develop your skills in that, and then that could lead to other things that perhaps you're interested in. Another suggestion is shadowing. This is the best way of gaining insight into an area that you are interested in. I think the best time to shadow is when you are a student nurse and you're starting to think about where you want to take your career as a newly qualified nurse. It is a little bit more difficult to shadow when you are a registered nurse because of time and so on, but it's not impossible. I believe with every nursing role, no matter what banding you are, there is a degree of leadership. However, if you want to take your leadership skills to another level and be able to utilize that on a daily basis, then there are definitely brilliant opportunities to develop into nursing leadership roles. Ultimately, the kind of career path that you want to be looking at is managerial roles. Some examples of great leadership roles in nursing include ward managers, care home managers, matrons, senior sisters, junior sisters, even the prospect of being a board director or the next director of nursing. These are all examples of leadership nursing roles and brilliant careers to pursue. One thing you do need to consider is the higher up you go within leadership, the less patient contact that you will have. But there's nothing wrong with that. That's something that you are okay with. If that's something that you don't mind, then it's all good. If you are interested in leadership nursing roles, then here are some suggestions on how you can develop. Liaise with your line manager about taking charge more in your unit. Take the initiative and openly say, I'm happy to go to the safety huddle / briefing and represent the ward in handing over patients. Try your best to take advantage of all the different leadership opportunities around you. Another suggestion is getting on board with a mentorship qualification. This is a great way of showcasing and practicing your leadership skills. To really excel within a leadership pathway, you will need to consider band 6 or band 7 positions. So keep an eye out, build your experience in an area that you love, and and be on your way to becoming a great nursing leader. Work-life balance is very important. It doesn't matter if you're working shifts or short day shifts or whatever, you still need to have a balance in your work life. If having a structure is a priority for you, perhaps because of family commitments, personal reasons, or maybe that's just you as a person, you need structure in your life, then you'll be pleased to know that there are great career opportunities for nurses that give you that work-life balance. I think there is this misconception that when you become a nurse, you have to go to a hospital and work on a ward, and then you are destined for this life of long day shifts and never having your weekends off and doing crazy night shifts. I mean, there is a degree of truth to that, but not the point I'm trying to make. There is definitely room for progression if you are looking for careers that give you that work-life balance. And these include primary care nursing roles such as general practice nursing, district nursing, immunization nursing, travel nursing, outpatient services, and even research roles. Usually these kind of roles work a shorter day. I know there's some changes made to the general practice nursing world where some GPs have extended hours, but that's all individual, so definitely do your research if you are looking to go down that route. If having flexibility truly is important to you, then perhaps you may be interested in something like bank nursing work or agency work. This is something that a lot of nurses actually do who really do need flexibility when it comes to their work life and they can't afford to be under a strict rota. The downside with something like bank work or agency work is there is no guarantee that you will get shifts in an area that you are interested in, and also shifts can get cancelled last minute, but definitely do more research into it because there's so many different agency organizations and trust policies related to it. So yeah, it's definitely an option for those of you who want that work-life balance. I have a lot of love for research nurses. Just think about this in a simple way. Within healthcare, there is always research to be done. We will always need research nurses. There are always new trial protocols, new drugs being tested, new care pathways being developed, and there needs to be ongoing research for that. There may even be a global pandemic that takes place and, I don't know, a vaccine needs to be developed very quickly. I know nurses who have actually been redeployed to research areas. That is how much importance is placed on this role. I've definitely grown a lot more respect for research nurses when I'm working in ICU and I see the nurses and the midwives coming on different COVID related medications, and it's a lot of work, it's a lot of things that go into it, a lot of behind the scenes work that goes on, and they play a really big part in a lot of the care that we provide to patients. Without research nurses, how are we going to be able to provide evidence-based practice? Definitely a brilliant career path to consider. And if that is a career path that perhaps you're interested in, then here are some suggestions. Every hospital trust has a research department somewhere. Liaise with the lead research nurses, and if you are a student, definitely ask if you can shadow for a day as part of your placement. Just some examples of some research roles include clinical research nurse, a senior clinical research nurse, even a research manager, and you can even become a university lecturer through research, which leads me very nicely to my next point. Educating others can be such an empowering feeling. Like, I personally love teaching. When you teach, you have this genuine drive to see others develop, and it brings you joy when you see a student or someone who you're helping actually develop and grasp something that they perhaps struggled with in the first place. Every specialty that you can think of, there is some form of educational progression. When I used to think about education nursing roles, I only thought you could become a lecturer at university. You would have had to have done years and decades in one area and had to be super old before you get to that point of being a lecturer, and only then would you ever get the opportunity to teach. That is completely false. Examples of brilliant nursing education roles include practice education facilitator, those nurses who help student nurses develop whilst they're studying, education leads, practice development nurses, clinical educators, simulation practice nurses, even becoming a clinical nurse specialist. There's always a degree of teaching with anything that you could do, especially as you go higher higher up within your career. And if you are nervous that once you pursue a career down education that you will lose your clinical skills, get that thought out of your mind. I'm going to show some extra love to my nursing lecturers at City University because I am biased and that's where I studied. So some of my lecturers were still working part-time in their hospitals in their areas of interest as well as teaching at university. So that way they were combining their love for clinical work with teaching as well, which it's fantastic. And I definitely would love to go down the education route at some point in my career and become a nursing lecturer. That is just the side of nursing that I do love. But yeah, we'll see. Let's see how that goes. If you are interested in pursuing an education nursing career path, then here are some suggestions. Think about mentoring courses. Mentoring is the best way to approach it, and pretty much every job description related to education roles will ask for at least a mentoring qualification. So you will also at some point need to consider a master's teaching qualification if you wish to climb the banding, develop your career. Nursing really is a fantastic profession to go into if you're looking for variety, and this is just a small insight into the many different combinations that you can achieve. A really important point that I want to make is you can change your mind. There is nothing wrong in that. If you are thinking right now, I definitely want to pursue a career down clinical route, and then a couple of months time or years down the line you want to actually pursue research, then there is definitely space and room to achieve that. So don't ever limit yourself, go for it and be the nurse that you want to be and that you know you are capable of becoming. If you like this video and learning more about nursing in the UK, then definitely check out my UK nursing playlist where you can find similar videos like this where I go into more depth about nursing life here in the UK. And if you've got any questions, you are more than welcome to send me an email or reach out to me and I will try my best to get back to you. Best of luck guys, I will see you in my next video. Take care and stay safe.